How to check blood return in your PICC line. Get your supplies, wash your hands, and get sanitizer. Once you get your gloves on, then what I do is I lay out a sterile field. When you clean your hands with sanitizer, make sure they are dry prior to putting your gloves on. Next, you'll get 2 alcohol squares. You're going to scrub your hub, which is your lumina. You want to hear the squeaks. You are going to scrub your lumina for a minimum of 30 seconds. I usually squirt out like 2 ml. And have your lumina and hold it. You will take the flush and push it in and turn to the right. Lumina, and you're going to put the flush onto your clave and make sure you push it in because of the valve and then turn it to lock it in place. Holding pressure on my line, on my dressing, because my dressing is loose, which can affect how my line will work. I'm re-sanitizing my hands though. Even though they're box gloves, they're dirty. Just think of it like, would you put a dirty tampon back up your vagina? Okay. So when you do the push pause forcefully, but not too forcefully, then you just pull back some, but not too much resistance in pulling back and get out all that old blood, because that is what causes blood clots, and that's what causes your line to malfunction. When you go to push your flush or medication and it does not want to go, do not ever force it or you will blow your line. So now we have to do an assessment. You're going to assess your line. If it's a clamp line, you're going to make sure the clamp is unclamped. You're going to make sure your line doesn't have a kink in it. Is your dressing loose? If your dressing is loose, make sure that you're holding pressure on your line as you're trying to flush it, and then make sure you get a hold of your home health company and your nurse to redo your dressing change. Do the push pause forcefully, but not too forcefully. Then you just pull back some, but not too much resistance in pulling back. And pull back and get out all that old blood, because that is what causes blood clots, and that's what causes your line to malfunction. It's important to check blood return every day. When you do not check it every day, then you can end up with problems. As you can see in this video, the blood is very, very thick and will clot. I recommend anytime you check blood return and it goes in your clave, after flushing with sodium chloride numerous times in heparin, you should change your clave. In the hospitals, I do not let them take blood draws from it unless they're doing cultures. And then I recommend taking the clave off and then pulling it from the hub with my assistance. Now, every hospital is different, but it's important to advocate for yourself and speak up and educate. Many of these nurses do not know how to properly care for PICC lines and central venous catheters. So it's important to work together with educating each other. Remember, this is your life, your body, your line. And you must have blood return for your line to be patent and working properly. Having trouble with blood return, you can try to get blood return out with a smaller syringe with a 3 ml or 5 ml. Now, when you are aspirating out, a smaller syringe is actually less pressure. I don't ever recommend pushing medications with a small syringe because it's too much pressure and can blow your line. However, when you're trying to aspirate to get blood, you can use a smaller syringe. Other helpful tools are power flushing. You can get a 20 ml of saline and do a bit of a pressure of a push, pause to see if that will clear it up. PICC line in your arm, you can order a limbo shower cover. A hot shower opens your pores, which can help with getting blood return. Now, if you have a central venous catheter like I do in this video, taking a hot shower and having your dressing change immediately after can open up the blood vessels for blood return. Your line could have shifted and changed positions during your last dressing change. Sometimes a dressing change can fix that. By putting heparin in your line and letting it sit. If none of these steps work, then you may need cath flow. Call your home health company to send your nurse out or go to the emergency room. Remember to subscribe, hit the bell, press all. That way you're notified every time that I upload. This is Diane Strong, HD Activist, and I'll see you in the HD Activist in the next video. Okay, it's Star, Diane Strong, HD Activist. And today, we're going to show you how my little HD Superstar helps me with my IV medication. So if I'm having a severe reaction, which then until don't touch nothing, you have to kind of give them reminders. Because if you're in a reaction and say you're locked in and you can't speak or communicate, it's very frustrating, right? And box gloves are dirty. Okay, think, would you put a dirty tampon back up your uni if you were a guy up your penis hole? Robert came in. And we always joke when he says he's going to jump off the cliff, or I'm going to jump off the cliff, just going to post the card. So he came in and he gave us. Yeah.